So today I'm going to present some of our research related to COVID-19. So my presentation today is COVID-19 knowledge graph, misinformation, and science. So this is my disclosure. I'm the co-founder of Data to Discovery and then owner actually of the company. First, I want to talk about our research to build a knowledge graph for COVID-19. So we collaborate broadly with people from Asia, US, and China. So before COVID-19 started, we actually spent a couple of years trying to process the PubMed articles, which is 29 million PubMed articles, to build a knowledge graph. So by collaborating with BioBird Group at Korea University in South Korea, we've been able to extract all the bio entities, which is drug, gene, disease, species, mutations from PubMed article title and abstract. We also collaboration with UIUC. We've been able to work with them to disaggregate authors. We also integrate data set from NIH Exporter, which is the funded project, and ORCID information for authors with employment history and education background. We also did affiliation parser to pass the affiliation to get country, city, and institution. We process this data, actually managed to build this large-scale PubMed knowledge graph, and this is becoming our very good background knowledge to help us to build the COVID-19 knowledge graph. So this knowledge graph actually contains author, PI, project, article, and affiliation, and also their bio entities. So this is the number of the statistics about the number of authors, bio entities, affiliation, and research employment, research education, each project. So it's a so based on this, we also have other data set generate from my company called Data to Discovery. Spend a decade of effort to integrate like 20 plus different public available database for drug discovery, including UniProne. UniProne is about the protein and gene ontology, string, and PubChem. It's a chemical compound, and drug bank, and so on and so forth. So by combining these two, we come out with idea how to build a COVID-19 knowledge graph. So since March, actually, White House released the COVID-19 data set, which are actually publications related to COVID-19 published in PubMed or in archive, by archive, and medRxiv. And this number is growing. So by March, actually, it's around 60,000 articles. Now it's 220,000 articles. So based on this data set, we actually extract entity and relationships using BioBird. And we also doing the author name disaggregation based on the PubMed knowledge graph. So we can build authors and bio entities and their relationships based on also the graph from Data to Discovery knowledge graph, drug discovery knowledge graph. Together we can we build this COVID-19 knowledge graph, and we can use path finding to find interesting paths and rank them. So this is one example. We show you from this knowledge graph, COVID-19 knowledge graph. We show you one example. Here is remdesivir. So remdesivir originally was developed by Gilead Science in 2009 for hepatitis C. Since COVID-19 started, actually remdesivir is one of the only treatment has effective for severe patients. So already has been authorized by several countries for emergency use. For instance, in India, Singapore, Japan, European Union, and recently the United States also authorized this emergency use. We can see the remdesivir are connected with other drugs as well, including those we heard very often in the news, chloroquine, and also some other, Chinese herb medicine, Shifeng, capsules. So you can give you a broad idea. So what I relate to this drug and what are others, this drug also, there are other genes that are related connections. We also can do a more in-depth analysis about individual entities. By entities, for instance, ACE2 is a gene. So this gene is very important. So for COVID-19, you have two phases. Phase 1, the virus has to come into your lung, actually binding ACE2, so they can enter in your lung cell. And second, they will do a millions of copies of themselves, actually destroy your immune system. So most people die of overreaction with the immune system overreaction with the coronavirus. So this ACE2 is one of the first important targets for people to find a cure for COVID-19. So there's a lot of drug repurpose has been done target this ACE2. We can see, so from the COVID-19 knowledge graph, we can see that this ACE2 actually, we started to have articles talk about this since 2001. SARS started 2002 to 2004. It has a similar virus with COVID. And MERS, the same thing, started from 2012 to 2020. So you can see there are peak in 2006. And also monthly, they have a lot of discussion related to this ACE2 since 2020. And those are related compound or gene or bioentities that relate to co-occurred with ACE2 very often. We also work with another group of people from Mount Sinai Hospital to do COVID-19 patient risk prediction. So we work with Mount Sinai. So Mount Sinai has one of the largest and most diverse patient population across 5 hospitals in New York, in actually downtown New York. So it's one of the major health systems in New York. This EHR data from Mount Sinai Hospital contains the following information about patients, their status, intensive care status, demographic information, lab tests, vital signs, comorbid disease, and outcomes, either discharge or death. Okay, we are facing 2 kinds of different data. So lab tests and vital sign are time series data, so a temporal data related to time, because it's being measured several times a day, or even several times within fixed period of time. So we have to deal with use time series deep learning to embedding those kind of temporal information. We also have the static features like demographic information and comorbid disease, and those genders, age, and races. And we have 12 different comorbid diseases. So these are static features. So basically, we use LSTM and with time-based LSTM to learn these time-based features related to vital sign and lab tests, and combine them as one embedding, and then we use we create a feature for static features such as demographic information, and we concatenate static and temporal features together, form a new embedding, and we actually propose kind of we call heterogeneous graph model. Basically, we treat death and discharge as 2 relations. So it's a relational learning to predict the patient outcome, is a discharge or death. So you can see this is a purple line is our method, and the others are baseline method. You can see we outperform baseline method. We also did misinformation about COVID-19, so it's a very different. Just when the COVID-19 starts, we start to talk to our collaborator in China. So we'll be able to get there's 3.3 million Weibo posts, And the misinformation collected from the Georgian platform. With these two data sets, we'll be able to address these following research questions. So how misinformation and gossip has evolved throughout the different stage of COVID-19 pandemic in China, and how this dissemination correlates significantly with news events and government policy. So you can see this is a timeline table. We start from January 19 and almost by daily. Each daily we have, the blue is rumor, the red is pseudoscience, and the green one is inconclusive. Now, all these little words here, it's hard to say, it's all these news events related. So we can see there are some peaks during like mid or late January, because there's some lockdown in different cities, and there's a different rumor about cure and so on. So we can see that this evolution of misinformation follows an issue attention cycle. It's related to events and government policies, and it's also related to topics such as city lockdown, cures, preventions, and school reopening. So we look at the temporal popularity of the cure. There's a lot of misinformation about cure spread in this platform, and the cure ranging from ginger, hot water, strawberry salt, and disinfections, and very widely. We look at also this misinformation. The dissemination of misinformation actually generated fears. For the public, these fears contains a cure, and it relate to actions and infected celebrities, and different misinformation about lockdowns and the blockage, and misinformation about the consequence, and misinformation about who is the first patient of COVID-19. There's one case about, so this is a cascade model for the Weibo post, which is similar like tweets spread in this community. So on January 31, Xinhua, so the red one, People's Daily and the Xinhua Shidian. It's a party-owned publisher. They actually quoted the article, say one of the, Shuanghuanglian, it's a Chinese herb medicine, actually can inhibit COVID-19. So, but the public has a misinformation about, misunderstanding about inhibit. They believe this inhibit means a cure. So there's lots of misinformation going on the spreading. And you look at the blue part. The blue part is the Jinxiang Doctor is actually community owned. It's actually self-organized physicians in this Weibo platform. They actually come out to declare this is, to further explain this inhibit as it's not cure, it's not a prevention. So just to clear the misunderstanding, potential misunderstanding in the public. It's just only 4 hours later. So basically, to prevent, to provide with the concern that people should not use it just to cure COVID-19. Okay, and we also did things about science. So COVID-19, about COVID-19 science. So we think whether COVID-19 actually will reshape scientific research and improve the novelty of science. So we, with this question, we actually analyzed, that time is we only have around 60,000 coronavirus papers. We did some use our pre-work. We built the COVID-19 knowledge graph. We used Firebird to pick up bioentities, and we calculate the novelty to say whether these two entities, the combination of the entities, whether they are novel or not. Novel means they never appeared before. The new combination of these entities appeared after COVID-19 happened. And we also look at international collaboration and the parachuting collaboration. That means parachuting collaboration means these two authors, this pair of authors, never collaborated before COVID-19. After COVID-19, this happened, they start to collaborate. So we want to see the trend of these three things. So it's very clear. So you can see that the novelty, the orange part, we can see the orange part in SARS 2003 SARS pandemic. It's actually increased, but it has a spike for the COVID-19 in 2020. Okay, and international collaboration for SARS has increased. You know, this blue line, but actually decreased 2020. You know, because of nationalism and people blame each countries, or you know, who caused this problem. So some countries even you know, actually prevent their scientists to collaborate internationally, or if they want to publish this in the international venue, they have to get a permission. So basically, the international collaboration really dropped down significantly in 2020. But the parachuting collaboration, you know, you can see parachuting collaboration increased in SARS, but also has also big increase in COVID-19. So this is the whole range, and this is more narrowed down to only 2018 and 2020. So they zoom in into this area to show the trend here. So it's very interesting to know actually novelty of research actually spiked after COVID-19. And currently I'm working with a couple of students from School of Information at UT Austin. We are building a COVID-19 portal. So basically it's more like so we get this 220,000 COVID-19 articles. So we build, for instance, like for UT Austin, what are the papers related to COVID-19? And what are the, in these papers, what are the entities like disease, drug, and gene they talk about? And what are the keywords? And what are the authors from UT that work on the COVID-19? And if you pick up one author, and you can see their publication, his publication, and his co-authors. And if you pick up one entity, say for instance, like let's say disease, COVID-19, we can say in UT Austin, you know, what are the papers related to COVID-19, this specific disease, and what are the authors working on this. So this is, you know, this is a highlight of several research in our team, which we have done with topics related to COVID-19. And I would like to highlight those research are truly international collaborations. So you can see, you know, the list of affiliation people from China, South Korea, US, and many different places. So I really appreciate this international effort to let us, we can contribute a little bit to, you know, combat, you know, fight against this COVID-19. So this is my email. Please feel free to reach out to me if you are interested in any of this research we are currently doing. Thank you very much.